Katleen, a nurse with Queens Medical Center, and Doreen Summers, a nurse executive with the Department of Veterans Affairs. Thank you so much for joining us tonight. We really appreciate it.
Thank you for having us.
Now, you two are up on the front lines. We want to talk about the federal government actually sent assistance here to Hawaii to help with two of our hospitals, Queens Medical Center and Kuakini. And so, we just want to know this week, I know the nurses flew in. Tell us how it's been so far.
As you said, we flew in on Monday. Everything has been great so far. We really, really appreciate all of the wonderful hospitality that all of the nurses at both medical centers have given to all of us. The week has gone very well. It's been very busy, fast-paced week, getting used to and oriented to both of the medical centers. The nurses are all now hard at work and working in both our critical care and medical surgical units in both facilities.
Katleen, when you heard that you were getting help from the VA, what was your reaction?
Well, during the surge, many nursing units were just short-staffed, such as mine. A lot of nurses were doing lots of overtime, double time. As nurses, we're very grateful that we're able to work and thankful that we're able to provide for our families, knowing that so many people are out of jobs in the state. However, all that overtime and extra work can lead to caregiver burnout, and mental and physical exhaustion can take its toll. So an overworked and sleep-deprived nurse is not a safe nurse. It's not safe for the patient, not safe for the nursing unit, not safe to themselves or their families. So to deliver the best quality care during this pandemic, nurses need to be supported, and with that is adequate staffing. So we're very fortunate, we're very happy that reinforcements have arrived.
And of course, you need to stay healthy as well, and that seems hard to do if you're just overworked like that. Now, so since these nurses have arrived, have you seen a difference in the hospital?
They've arrived just a few days ago. Some have come on to our units. We've met several of them. We'll still need definitely more reinforcements, but it is a glimmer of hope. We're stepping in the right direction. Our COVID numbers are slowly trending down statewide, and really that's just a reflection of everyone's coming together, and that will show in our hospitalizations, and hopefully, that will go down, and we'll get more reinforcements with travel nurses and later in the month as well.
Now, speaking of that, at Queens, how is the hospital looking right now in terms of COVID-19 patients? I know at one point there was, an overflow of patients, but you said that number has gone down a bit. Just what does it look like in there?
I want to say in August, we had that humongous surge, and we were in, we were almost in a panic crisis mode at that point. But with this new lockdown order, our numbers, like I said, are trending down. I can't give you specific numbers, but I can tell you it's more manageable right now. And I can only thank really the public for doing what they're doing, what we're asking them. It's very difficult to, continue with the stay-at-home order, but we are doing this for a reason. We are saving lives with this, and we just want to thank everyone for doing what they can.
Doreen, you were telling me you brought in 15 ICU nurses. Is there a reason no doctors came on this trip as well?
For this trip, only nurses were requested, and it's a partnership between both the Department of Veterans Affairs and the U.S. Public Health Service. And in totality, we have 30 RNs with us here, 15 of those being intensive care unit nurses, as you mentioned, and then some of those being telemetry and medical surgical nurses as well. And those are all to supplement the nurses and help with the reprieve, as she discussed, in all of the units.
And when you came, how did you find the situation at the hospitals?
Things were going very well in both medical centers, and as we discussed earlier, it's really about giving the nurses some reprieve, some rest. They've all been working very, very hard over the last several months to care for the residents of Hawaii, and we're glad that we can be here to help give them some rest so that they're able to then continue on and continue to care for those patients.
And the nurses that flew over, was this a volunteer basis? How are they picked? And some of them are also leaving their families back home from wherever they came from, right?
Yes, absolutely. It's a big sacrifice for all of those who traveled here. In the U.S. Public Health Service, it is a commissioned corps. That is not a voluntary service. However, they're glad to be here and really want to help with the mission, as well as the Department of Veterans Affairs. That is a disaster medical corps. Those nurses nurses volunteer and they sign up with the Department of Veterans Affairs. They're on call basically for national disasters that might occur, and this is one that occurred, and those nurses were called and came to the call of duty here in Hawaii, and as you said, volunteered to come.
Oh, we're so grateful for that. Now, Kathleen, I have a question for you since we have you in studio. You're on the front lines. You're dealing firsthand with people who have COVID-19. I know there's some people out there that, may not be taking it seriously, but
Yes.
what is it like to be in there with patients who aren't able to see their families? They might be in critical condition. I mean, tell us, what is it like? You're the one with them.
I'm still perplexed that there are skeptics out there, but it's very difficult for all involved, especially the patients. They're alone, they're afraid. Often there's a language barrier on top of that, and then they're struggling to breathe. They are catching their breath. As nurses, we have to reassure them, we have to comfort them, provide them the physical needs that they're there for. It's no different from caring for a regular patient that's a non-COVID. We continue to deliver care with compassion, aloha, respect, and excellence. All the mission, encompassing the mission of Queens and what our founding fathers would have wanted us to do. We do the best we can to maintain that human connection despite the PPE and fully dressed. Technology has also been very essential in communicating with their families. Oftentimes we are facilitating WebEx meetings with the iPads with these families and the patient, and otherwise they can't communicate with anyone. All I want to say to those people that are skeptics, I've been doing this since March. I'm a frontline COVID nurse. I've taken care of these patients. I personally know people who've had COVID. The science and the data are here. And walk in a healthcare worker's shoes. Don that PPE. Be in that bedside for that dying patient. And then be on that iPad and tell them families that your loved one is dying. It's very difficult. It's tragic. It's awful. It's sad. And no one should ever have to endure that. People say, we have rights. This is our rights to not wear a mask. But you know what? Everyone has a right to not have this disease. And so to the people that are continuing to social distance and physical distance, masking up, hand hygiene, I want to commend you and thank you. You're doing your part. You are helping us to save more lives. Yours and your loved ones as well. So together we can, Hawaii. We can get through this. And the nurses at Queens will be here for you if you need us.
Thank you for sharing that, Kathleen. Doreen, real quickly, any lessons you learned on the mainland that you were able to bring here to Hawaii?
We were able to bring many lessons. Many of the nurses are from different areas around the country. They've all learned lessons in taking, as she said, taking care of COVID patients, whether it comes to the compassion, the high quality care that they provide, the little tips in talking with families, the telehealth. There's all different lessons that we've learned, and we've been able to bring those here and share those and work as a team with the nurses here in Hawaii.
Well, Kathleen Miyashiro and Doreen Summers, we want to thank you so much for your time tonight and for coming in, for giving such an interesting perspective, and for everything you're doing out there as well. Thank you so much.
Thank you.
Thank you.
Well, taking care